Welcome to the Piedmont Triad Regional Council Area Agency on Aging's listening session on the American Rescue Plan Act, also known as ARPA. This funding opportunity is for in-home aid. The information on this funding opportunity can be found on our website, as well as the application and list of other documents needed in order to apply if your agency has never been funded by the Piedmont Triad Regional Council before. This request for application is for grant proposals funded by the American Rescue Plan Act of 2021, also known as ARPA. ARPA funds provide a unique opportunity to consider needs in service delivery that have the potential to respond to unmet needs of older adults and family caregivers. The Piedmont Triad Regional Council Area Agency on Aging is taking a regional approach in distributing these funds based on the priorities established by the North Carolina Department of Aging and Adult Services. Service match is not required, and funds will remain available until expended or until September 30, 2024, whichever comes first. The project period for this funding is October 1st, 2022 through September 30, 2024. All ARPA funds must be obligated by September 30, 2024. The Piedmont Triad Regional Council Area Agency on Aging is making 3 ARPA in-home aid service mini grants available in the amount of $150,000 each. These are available to state licensed in-home aid agencies for service delivery in one or more of the following counties: Alamance, Caswell, Davidson, Davie, Forsyth, Guilford, Montgomery, Randolph, Rockingham, Stokes, Surrey, and Yadkin. These funds are for serving people aged 60 and older who are unable to carry out tasks essential to the activities of daily living or the instrumental activities of daily living, who have no responsible person able to perform these services, or they need the services in order to remain at home. Priority consideration will be given to proposals that address the needs of older adults who are underserved or underrepresented. Licensed in-home aid services providers awarded the grant funding must meet the North Carolina Department of Health and Human Services Division of Aging in-home aid service standards from July 1st, 1992 for in-home aid. The purpose of the ARPA in-home aid mini grant is to provide in-home aid services in order to improve the health to qualified individuals aged 60 and older, reduce the overall cost of health care, enhance the patient experience of care, improve the experience of healthcare workers, while piloting a program which provides a pass-through hourly wage for employee in-home aid workers in the range of $13 to $15 per hour, with an agency billing rate not to exceed $38 per hour. Successful applicants will track client satisfaction, the in-home aid worker satisfaction, and in-home aid retention over the grant period, in addition to providing the in-home aid services for older adults. Eligibility requirements for the ARPA in-home aid. Clients must be 60 years of age or older, and income is not used to determine eligibility. The individual is unable to carry out at least one or more tasks of essentials to the activities of daily living, ADLs, or the instrumental activities of living, IADLs. The individual needs help with these tasks in order to remain in his or her home. A responsible person is not available to perform these tasks, or the primary caregiver needs relief. Reporting and documentation requirements for ARPA in-home aid. A client registration form, also known as the DAAS 101, must be completed for each eligible participant receiving services through ARPA in-home aid funding. Client assessments and client reassessments must be conducted for in-home aid clients according to the Division of Aging in-home aid service standards and the North Carolina state licensure. Consumer contributions must be solicited and properly documented for each eligible participant receiving services through ARPA in-home aid funding. Cost computation requirements for ARPA in-home aid. Accurately completed cost computation forms will be required of all ARPA in-home aid grant awardees. These forms will be found on our website. Reimbursement for ARPA in-home aid. ARPA in-home aid reimbursements are handled through a reimbursement system. The reimbursement payments are based on units of service provided to qualified clients who meet the criteria according to the Division of Aging in-Home Aid Service Standards and the North Carolina State Licensure. Services provided will be reimbursed on a monthly basis through the state's Aging Resource Management System, also known as ARMS, and reimbursement is dependent upon accurate reporting of service data. Monitoring. All services provided by ARPA in-home aid funds will be monitored by the Piedmont Triad Regional Council Area Agency on Aging according to a timeline established by the North Carolina Division of Aging and Adult Services. Monitoring will be conducted through the Piedmont Triad Regional Council Area Agency on Aging's policies and procedures for monitoring. Confidentiality and security. Client information in any format, whether recorded or not, shall be kept confidential and not disclosed in a form that identifies the person without the informed consent of the person or legal representative. Community service providers, including subcontractors and vendors, must adhere to all applicable federal, state, and departmental requirements for protecting the security and confidentiality of client information, including, but not limited to, appropriately restricting access, establishing procedures to reduce the risk of accidental disclosures from data processing systems, and developing a process by which the North Carolina Division of Aging and Adult Certified Services is notified of suspected or confirmed security incidents and data breaches. Record retention and disposition. All community service providers are responsible for maintaining custody of records and documentations to support the allowable expenditures of funds, service provision, and the reimbursement of services. Service providers must adhere to the approved record retention and disposition schedule posted semi-annually on the website of the North Carolina Department of Health and Human Services Controller at the link shown on the screen. Service providers are not allowed or authorized to destroy records related to the provision of services under the agreement, except in compliance with the approved DHHS retention and disposition schedule, which allows for proper destruction of records based on a schedule by funding source and fiscal year. Confidential records will be destroyed in such a manner that records cannot be practically read or reconstructed. As a reminder, the project period for ARPA in-home aid funds is October 1st, 2022 through September 30, 2024. 3 copies of the request for application with original signatures must be submitted to the Piedmont Triad Regional Council Area Agency on Aging, located at 1398 Carrollton Crossing Drive, Kernersville, North Carolina 27284. Attention Gwen Shields, by September 16, 2022 at 4 p.m. Applications received after this date and time will not be considered for funding. Proposals that best meet the Piedmont Triad Regional Council Area Agency on Aging's expectation for service delivery will be selected. Applications will be scored based on their completeness and their description of intent to provide services. All questions regarding an RFA must be submitted in writing by September 9th, 2022 by 4 p.m. to Susan Ferriola at sferriola@ptrc.org. After such time and until the projects are awarded, applicants are prohibited from contacting PTR AAA staff regarding any issue relating to these funds or the application process. The Piedmont Triad Regional Council Area Agency on Aging reserves the right to reject any and all applications, waive technicalities, and to be the sole judge of suitability of the services for their intended use, and further specifically reserves the right to make the award in the best interest of the PTRC AAA region program. Failure to respond to any requirements outlined in the RFA or failure to enclose complete copies of the required documents may disqualify an application. Announcement of funding available will be no later than August 24, 2022. Final day to submit questions is September 9, 2022. Applications are due September 16, 2022, and an award announcement will be made in October of 2022. Evaluation criteria. The Piedmont Triad Regional Council Area Agency on Aging has developed a scoring tool to evaluate applications. The tool will be available on the PTRC website under the In-Home Aid Services at the link shown on the screen. Proposals that best meet the Piedmont Triad Regional Council Area Agency on Aging's expectation for service delivery will be selected. Applications will be scored based on their completeness and their description of the intent to provide services. Priority consideration will be given to proposals that address the needs of older adults who are underserved or underrepresented. In review, 3 mini grants of up to $150,000 each may be awarded. All expenditures must be reasonable, necessary, and justifiable. All funds must be spent on the activities related to the ARPA In-Home Aid program. An organization may submit applications to provide ARPA In-Home Aid services in multiple counties. Each application will be reviewed separately. Request grant amounts cannot exceed $150,000. Monitoring. A reminder that all services provided by ARPA In-Home Aid funds will be monitored by the Piedmont Triad Regional Council Area Agency on Aging according to the timeline established by the North Carolina Division of Aging and Adult Services. Monitoring will be conducted by the Piedmont Triad Regional Council Area Agency on Aging's policies and procedures for monitoring. Subcontractors. No subcontractors may be used by the home care agency to provide services described in the RFA without the express written permission of the Piedmont Triad Regional Council Area Agency on Aging. This concludes the listening session for the ARPA funding opportunity for in-home aid services.